individual. A little bit about me before we get started. I am a faculty member in the School of Pharmacy. I've been with Wingate for almost 11 years now. And I split my time between the classroom as well as being a clinical pharmacist. So essentially what that means is I work with patients in a family practice clinic, actually where I am right now. And I see them for a variety of chronic disease states, things like diabetes, hypertension, obesity, and I help to treat them medically as well as work to help them make a lot of behavior changes regarding taking their medicine, changing their diet, changing their exercise, changing a lot of different things. So that's sort of where my expertise in this topic comes from. Included a couple of pictures of you. I also have a family. This is my husband, and then I have an almost 3-year-old Lucy. I wanted to share my contact information with you all as well. If you have any questions after the fact or wanted to connect or anything like that, happy to continue the conversation after the presentation today. As far as our objectives, hopefully by the end of the presentation, you'll be able to define and then apply the Transtheoretical Change model. And then a common thing that we're going to work through today are some barriers to behavior change, and hopefully we're going to work through some ways to overcome those barriers. All right, so before we actually get into this question, what would really help me out is if through the chat, if you don't mind, if you could just type in and send a message just to the general chat of what is your current field of study? So that way I have an idea of who's all on the call and what you guys are doing right now. All right. So seeing a lot of different things come through, but it does look like some potential medical field people, and then as well as some business and things like that. And again, no matter whether you're going to be a manager, whether you're going to be working with people, with patients, with students, you're going to be helping people change their behaviors or potentially need to change behaviors of your own. So hopefully this will be something that you guys find applicable to you. So first question for you then would be, if anybody makes a New Year's resolution, you can just throw up an emoji if that was something that you typically try to do. If you do, it's not letting me advance the slides here. If you do, you're one of about 190 million people in the United States that typically does. Makes up about 74% of the population. When a group of people were surveyed, sort of the top areas for resolutions typically come in the area of health. That it would be something related to exercise or eating healthier. You could see saving money or spending more time with family is often another reason for a change. When you look at how people feel about how likely they are to maintain or achieve their New Year's resolution, you can see that younger generations actually believe that they are more likely to, but still just around like 80%. And you can see that the older people get, maybe the more experience they have in trying to hold a New Year's resolution, their confidence fades a little bit here. The most common reason cited for not keeping a New Year's resolution is a little different based off of things like gender or age group. But for the most part, what it looked at in summary is that people feel that they are either lack willpower or they lack self-control. So focus a little bit more on the college environment. Want to just again, throw up a thumbs up or something along those lines. If you at the beginning of the semester decided, I'm going to change something about how I study this year. So maybe you are the person that previously waited till the end, right up before the test to study, or you forgot a couple assignments and before the semester you already say, nope, I'm going to change things this year. I'm not going to be so stressed. I'm going to work ahead. I'm going to have it done. Or maybe the comment was, you know what, I'm going to keep going to the gym, or I'm going to keep exercising this entire semester, or I'm going to get to bed earlier. I'm not going to stay up so late. So a lot of times we're trying to change those behaviors in some sort of way, even if we're not setting like an intentional resolution or something not formal. When looking at why it is difficult to change a behavior, it's because whenever you're trying to change what you're seemingly thinking of as one behavior, you're actually trying to change two behaviors at the same time. And what I mean by that is not only are you trying to create something new or a new habit, you also are trying to disrupt or change an old thing, right? So to go to bed earlier, you not only have to try to go to bed earlier, but you also have to change the habit of going to bed too late. So it's 2 actions in one. The other thing is, most of the time, the habit that you're trying to change or the behavior that you're change is potentially a little bit unfamiliar. And most of the time, if something is unfamiliar, it makes us feel a little uncomfortable. All right. For most people, being uncomfortable is uncomfortable, and it's something that we try to stay away from. So we tend to go back to something, that old habit that might make us feel a little bit more comfortable. The primary indicator, or basically the number one thing that predicts whether someone is going to be successful at making a behavior change, is actually not their willpower, or not how much that they are committed to making the change, or not how much they know about making the change. None of those things come close to comparing to their ability to manage when it doesn't go well, when there's some sort of setback, when there's some sort of barrier, or there's some sort of lapse that comes in the way. All right. And so part of what we want to focus on when we're either helping ourselves or helping someone else try to change a behavior is really trying to prepare for what those potential barriers might be and come up with solutions to get through them. All right. We also sometimes have to change our mindset. A lot of times we think very black and white, and we think that it's either success or failure. I either did it or I didn't do it. And as soon as we start leaning towards that side of, I didn't do it, I wasn't successful, I had one day where I didn't eat healthy, or I had one day where I didn't go to bed on time, or had one class that I forgot an assignment in, a lot of times we view that as a failure, and we just throw our hands up and say, well, now I can't do it anymore because I already failed. All right. So most likely, and I'm sure you might have seen this image before, what most people think changing a behavior is it looks like this straight line where you're just continually having forward positive progress. And for most people, change process is very messy, and there's lots of ups and downs that happen. So again, if you were to stop making a change right at this first thing because you had this minor little setback, it's the people that can push through that to get to the next peak that sort of are able to keep going in the right direction. So our primary indicator is that ability to process and manage setbacks or relapses. All right. Another really interesting thing that comes out in the literature that sometimes, quite frankly, isn't really practiced all that well, is that when you're asking someone to change behavior, or you're asking even yourself to change behavior, that using fear or negative information are more likely to convince someone to not do a certain behavior. All right. So for example, probably one of the biggest behavior changes that has been going on in society as a whole is trying to get people vaccinated for COVID. All right. The research would say that trying to get someone to get vaccinated for COVID, the worst way to convince them would be to threaten them with the negative information of, if you don't get it, you're going to get sick. All right. What is shown in the literature and the evidence is that using positive information is actually more likely to convince someone to take action to change a behavior. So giving them information on the benefits of something, how it's going to keep you out of the hospital, it's going to keep you safe, it's going to keep your family member safe, it's going to keep your community member safe, that would be more likely to get someone to take action to do something than by telling them that they needed to be terrified of COVID and so they better get the vaccine. All right. Now, if the behavior change you're trying to make is to get them to stop doing something, like maybe stop smoking or something like that, that's where sometimes the negative information can be the most impactful. But if the behavior change is to add something in or to change something in that way, positive information is the most beneficial. And then this ties into the previous point, basically, of that primary indicator being the ability to process setbacks. The most common reason that people struggle with behavior change is because they don't have a complete enough plan in place. Okay, so some examples of this might be, let's say you go in and you have this idea of how you want to change things, for the semester. Again, you don't want to be so stressed. They're not going to wait so long to study or whatever it might be. And you go talk to your advisor about it, and your advisor says, yeah, that sounds like a great idea. Let's do that. But if that's all the further thought that's put into it, if there's not a system put in place to make sure that happens, then you're most likely not going to hold true, because you're going to go back to those old habits. So the failing to plan is what gets in the way of being successful. So looking at the actual transtheoretical model of behavior change, there's kind of several different steps along the way. And what you'll notice is that there's kind of two different ways of visualizing it. One is sort of on this continuum, okay? And what this arrows are meant to represent basically is that no one person just moves in one direction forward. So you can start at one phase and move back towards the other one. You can go in either direction, basically. I sort of actually prefer to look like it more as a cycle because this is what I tend to find comes to be most true. So let's kind of break into each of these sections in a little bit more detail. So the first phase is called pre-contemplation. And more clearly, pre-contemplation basically means that the person is not ready to make a change and actually not planning to make a change anytime, really even in the next 6 months. Okay, so this is someone that's not even really, it's not on their radar that this might be a behavior that they need to do something different. The reason that someone might not be even thinking about it is that they could be just unaware of the thought of the information. It could be that they have had a previous time of trying to change that behavior and been it hasn't gone successfully. So that person has maybe already ruled out, well, I can't quit smoking because I tried that a long time ago. It didn't work. I'm just a smoker. That's just who I am. So I've just already accepted that. All right. Oftentimes people in the pre-contemplative stage are thought of as just being resistant or unmotivated or unready. And sort of labeled in a way that doesn't really help them move further in the process. So a good thing to do if someone is in the pre-contemplative stage, or if you or yourself are in the pre-contemplative stage about doing something, is often to try to share some information about how that change might impact someone in a positive way. Or it might just be to sort of engage them in questioning or getting curious as to why they haven't considered making that change before. Sort of asking just, ambivalently, not trying to put too much weight on one side or the other, but why wouldn't you want to make this change? Can you tell me more about how that would impact you versus how would it impact you if you did make this change? So just trying to get them to sort of look at it from a different viewpoint. The next stage is called contemplation, or this is essentially when you're more getting ready to make a change. All right, this is when you're not quite there yet, but you're thinking maybe in the next 6 months is the time frame. So in this phase, you're not uninformed. You're more aware of the pros and cons of making this behavior change, but you're still in something that we call decisional balance. And so when we call something decisional balance, essentially what you're trying to still understand is whether the pros and the cons actually level out, or are the pros of doing something actually greater than the cons of not doing it. Okay, so someone in the contemplative stage, again, knows these things, but they're still in this sort of state of trying to weigh out the pluses and minuses of doing something. The next stage would be preparation. And this is where you're actually sort of moving towards making a change. You're ready to make a change. You're planning on doing something within the next 30 days. Okay, most of the time, some sort of plan towards this change has been formulated. Again, you're thinking, okay, I'm going to start doing this when my classes start on this day, or I'm going to start doing this on the first of the month, or I'm going to start doing this after spring break, or I'm going to start doing this at the start of the semester. So there's some sort of timeline in place, but the main part of the preparation stage should be developing a bigger plan of action. Okay, so again, one of our main reasons for failing is for not having enough plan or for not being able to manage setbacks. So one of the biggest things that either you yourself want to do during this phase or you want to help someone else do is try to think in advance what might be some things that might get in your way of being successful at this behavior that you're trying to change. Okay, so it could be, let's say you're trying to change your diet, you're trying to eat healthier. Okay, part of the problem could be that your friend group really likes to eat at a certain fast food place. Okay, so if we just say, well, I'm just never going to go, I'm just going to avoid it, right? Just not going to go with my friends to that place. It's not really setting ourselves up for success because we're sort of just trying to remove or avoid the situation. What might be better is thinking, okay, if I go to this type of place, rather than ordering what I always order, is there something healthier that falls in line with what I'm trying to change my diet to that I could do a better job of sticking of? Or when my friends say they want to go here, where would be an alternative that I could suggest? Okay, so trying to think through those exact steps. In my line of work, a lot of people do make change successfully for especially this time of year, they do pretty good throughout January, but then February hits and it's Valentine's Day, and then it's Easter and it's spring break, and there's candy in stores, and there's all different sorts of things like that that might throw them off track. So again, we have to talk about those ahead of time. What might be coming up? Is it a vacation? Is it your birthday? Is it your anniversary? How are we going to handle those things so we're not viewing those things as just something that completely threw us off track? Having some sort of plan of what's that's going to happen. Thinking through, if you're going back to sleep, if I'm going to go to bed earlier, what does that mean throughout the rest of your day? How are you going to have to do things differently at noon so that way you can get in bed by 11 o'clock at night or whatever it might be? So coming up with specific action-oriented steps. The next step is where you actually move into the action. So this is where you're taking very specific, very overt modifications to make your behavior change. All right. Ideally, you're still working through you're still updating your plan as you go through, and you're figuring out what is successful and what's not successful, but you should still actually be making the behavior change at this point. The next step would be maintenance. So again, this is more of where you have done this behavior change for about 6 months or so, and you're just trying to maintain it long term. So I was able to achieve that during the whole spring semester. How am I going to make sure I continue this behavior over when something changes in my environment or whatever this means? For some people, even the change of seasons can throw them off of their maintenance. Let's say they made an exercise plan that they were going to walk outside, and then all of a sudden it gets really cold in the winter. Again, during that maintenance phase, we kind of need to be constantly updating our plan. Unfortunately, then we can also have what's called the relapse phase. And so this might be that if someone either comes out of maintenance or if they didn't get all the way to maintenance, is that, again, those old behaviors or the plan wasn't solid enough. And so we had a minor relapse. Some people can shift from that relapse phase back into maintenance or back into action. And again, those are the people that are generally going to be more successful at making the behavior change. But some people end up back in that pre-contemplative state. So again, saying, well, I tried, I did it, I failed, I can't do it again, so I'm not even going to try. So that's going back to sort of not even being willing to consider making a plan of what to do from there. All right, one of the key things that come in with making a behavior change is the idea of self-efficacy. And self-efficacy is essentially two things. So it is your degree of confidence in being able to make the change and maintain the change. It is also the degree of temptation, or basically things working against you in a higher risk situation. So again, going back to that example of eating healthier, if you have people around you or you're in an environment where you're constantly exposed to things that you're trying to avoid, that might make it a little bit different, or you might have your self-efficacy be a little bit lower. All right. Some tools that can help with self-efficacy could be just going based off of past experience. So that's inactive self-mastery, where you can just say, I've done this before, I could do it again. It could be role modeling. So this could be, watching someone else do it, having a friend do it with you, just visualizing yourself being successful. It could be giving yourself some verbal pep talks or something along those lines, or also giving yourself some psychological support. So again, these could be from outside sources, or these could be something else, a journaling exercise to sort of get out your feelings related to something. So that way you can move through the next step of the change. There's a couple other pieces that can come into making or going through the transtheoretical change model. Some of them are cognitive, which is basically trying to help retrain how someone thinks. And some are going to be more behavioral, which is basically trying to, again, change the behavior, the physical actions themselves to try to reduce the risk of relapse. So conscious raising from a cognitive process, this basically means you're just getting the facts, you're getting the information. So this could happen during that pre-contemplative or contemplative area, but really it should keep happening even during those action and maintenance steps to sort of continue to reinforce why this behavior change is important. You can also do what's called dramatic relief. And so this would be sort of paying attention to those inner feelings and desires and emotions that are prompting you to want to make this change in the first place. Why are you wanting to do it? Environmental reevaluations is when you notice the effect of your behavior change on other people. So for some things, this could be a positive effect on other people. Sometimes it can also somewhat negatively affect somebody else. So let's say you deciding to go to bed earlier affects how your partner does things because they don't like to go to bed earlier and you're missing out on spending time with them. So environmental reevaluation could cause you to basically improve your chances of making behavioral change, or could also go in the other direction. Self-evaluation is basically changing how you view yourself or changing your self-image related to this behavior change. Oftentimes we give ourselves labels, or we have been labeled by other people that we internalize. So this is something, again, for a lot of patients that I work with, they have already viewed themselves that I am a smoker. That's who I am a smoker. I just can't change that. Or I have a problem with my weight. I know that I always have, I just will, and I'm just going to have a problem with my weight forever. So they've sort of always labeled themselves in a certain way or have this self-image. And so sometimes some of the work of the cognitive process is trying to adjust that to saying, well, what if you weren't a smoker? What if you didn't have a problem? What if you didn't always see yourself having a problem with the weight, and sort of going from there? So social liberation processes are around the idea of noticing public sources of support. So in public health, a lot of these sources of support can come from multiple places. So it could be following something on Instagram that reminds you to go to bed sooner, or that reinforces some of that information in a positive way. It could be the fact that there is a gym on campus that gives you resource to exercise equipment, different things like that. It could be that there's water stations around, so that way if you're trying to stay more hydrated, there's something there. It could be that you have an Apple Watch or an alarm clock or something like that that sort of helps you keep in check with different things. So there's a lot of different sources of public support that could maybe make your behavior change a little bit easier. Next, kind of stepping into these behavioral processes, again, thinking more of the action steps. The first is self-liberation, and this is sort of actually just making a commitment. And the idea of changing these behaviors is, again, we're trying to reduce the risk of having a relapse. So you're making a commitment, you're just kind of doing the action. No matter what, I'm going to make sure I do this action that I said that I was going to do. Counter conditioning, this would be an example of basically using something as a substitute. So for example, if you are a person that drinks a lot of soda, all right, and you are trying to work yourself off from drinking soda, maybe going from soda to water is a little too hardcore for you. So using counter conditioning would be using something like, I'm going to switch to Coke Zero products or Pepsi Zero, whatever they are. I'm going to use those products first. Or I'm going to switch to an undecaf coffee rather than regular caffeinated coffee if I'm trying to reduce my caffeine content, because I'm just not ready to completely get rid of my taste of my coffee. So it's sort of using a substitute or something to move you through. In some ways, this can be really beneficial. In some ways, we can just sort of transfer our behavior to the substitute. And so we want to make sure that that substitute is actually a behavior that we want to be doing. And for other people, it can be used as sort of a gradual step down method. So depending on the behavior change, this could help us be more successful. Helping relationships sounds exactly what it sounds. So whenever we're making a behavioral change, having positive support and reinforcement for that can make a big difference. So another big mistake I often see people make when they're trying to make a change is they try to keep it a secret. They just want to show basically the end result to everyone. Look at me, look how much I've done this differently. When actually they could be a lot more supported throughout the process if they told even just a few key people in their life, this is the change that I'm looking for. Can you check in on me? Can you make sure? Can you help support me when we go to that restaurant as friends? Can you make sure, you know, we can sit next to each other so I can have that support, so I don't just order something that I normally would, or whatever it might be. So having that supportive environment can be really important. Some people do really well with reinforcement management, which essentially means giving yourself a reward. So this could be more of a long-term reward of, once I do this 20 times, then I get to do this special thing. It could be sort of more of an instantaneous reward. So for different people, the rewards will work a little bit differently. What I think is important to realize is, one, making sure that that reward is also something that is in line with what we're valuing or what we're trying to do. So for example, someone is trying to work to eat healthier, having a reward of a ton of less healthy food options probably isn't to like binge on isn't the best thing to have as a reward mechanism. And we want to think about how our relationship to that reward might change. So oftentimes the more we're rewarded for behavior, the more we get that reward, it loses its specialness, for lack of a better word. And so then it becomes less motivating because we don't really care about the reward that we're receiving. So it can be effective in the beginning, but it might be something just to consider as a long-term tool. Stimulus control essentially focuses on doing things to manage or control the environment. And so what I mean by this is, depending on what change you're trying to make, is trying to, as much as you can, manage the things around you to make it more conducive to that. So again, if you're giving up soda, Maybe not having a fridge full of soda would be something that you could do to control your stimulus. For people that are trying to quit smoking or vaping or something like that, not having an ashtray around, not having something kept in their pocket, all those different things that just make it very easy to access or puts you in the mood or environment where you want to do those things. And again, sometimes you have control over it, sometimes you don't, but managing the environment can be really important. Something else that can be really important to analyze when you're working with other people, as well as working with yourself, is the idea of the access to different support and resources that you have. Depending on the person, their access to resources and support might be very different. And so bring up the idea of inequality, equity, equality, and justice. And so basically when we have inequity, it's the idea that there is unequal access to opportunities. So this person has all of the resources and support they need, whereas this person's not getting anything. If we look at equality, this means we've evenly distributed some sort of tools and assistance. We've given both of these little boys a ladder, the exact same ladder of the exact same height. Essentially, what we've done is just make it easier for this person to get something they were already getting. And because we didn't give this person any, and we'd give it all equally, we didn't give it to the person that maybe needed a little bit more help. And so we're still in the same situation of one person using the resources and getting them and one person not having access. The idea of equity basically moves toward the idea of customizing the tool or the resource that meets the needs of the person. So essentially here we have the person is getting a slightly taller ladder to reach that versus this person over here. So they're both getting a ladder, they're both getting support, they're both getting help, but we have individualized it so that way they both end up having the same outcome. The next step would actually be justice, and that would mean actually changing or fixing the system itself to be able to have this equality in resources and tools. So this basically, the image here basically means we're trying to tilt the tree back up to being straight. All right, so this could come in for you personally, and it's something as you're trying to change a behavior, as you're working through your individual barriers or setbacks, that you might need to spend some time looking at for yourself and think about where could I go where I'm going to get equitable resources for myself. Again, if you're working with other people, either in a management role, if you're working with patients, if you're working with different things, we have to understand that maybe the recommendations that you're making to people all sound great on paper, but is it actually achievable for them to use or to incorporate into their lives or to their system? And so oftentimes we can't just make these outright statements of this is the only way to make this behavior change, because we're going to have to individualize it and customize it to an individual person's needs. When you're managing setbacks and relapses, again, this is key into making the behavior change. One of the biggest keys to people that are successfully able to move forward is that they turn a setback or a relapse into some sort of learning process. Again, you're getting curious and you're thinking about what here happened. Why did I have this setback? Why didn't I keep going with this behavior that I know that I want to change? All right, what did I learn about myself? What did I learn about my environment? What did I learn about the tools that I have been using? All right. Then it's important to think about, rather than just immediately jumping back in and saying, okay, I messed up, but I just have to go back to making this behavior change again right away. You want to think through what are those steps necessary to sort of work through or think through, how do I get myself back to that behavior change? So again, if it was something in your environment that maybe triggered you, or a person or something like that, you weren't getting enough support, rather than just jumping back in and still having that trigger, or still having that temptation or that environment, or still not having a support, maybe it would make sense to pause that behavior change, go find some sources of support, go remove that thing from your environment, take the steps to make that happen, and then rework your plan and say, okay, and after I do this and this first, then I can jump back into that behavior change. All right, so thinking through the plan first versus just jumping back in can be really important. Because oftentimes if we have back-to-back relapses or what we term in our mind as a failure, that makes us even less likely to jump back into the behavior change. Lastly, I think this is very important, is we need to think about how we're treating ourselves while we're working towards this change, okay? So oftentimes what I find is that people have labeled whatever behavior they're trying to change as bad. This is bad. And so if I happen to have a relapse or a setback and I do that behavior that I have said is bad, then therefore I am bad for doing it. And what I often find and what the research shows is someone feels that they are bad, what they're doing is bad. Then they sort of go, well, if I'm bad, I might as well just be really bad. And a lot of times it actually amplifies their behavior that they're doing that they actually want to change. So to give a more concrete example, right? So if someone views eating a cookie as bad for them, right? This is bad, I can't have this. Then all of a sudden they give in one day and they have that cookie. They're bad for having the cookie because the cookie is bad. So now why not just eat the whole package of Oreos, right? Because I'm already bad, so let me just be really bad. When in actuality, having one Oreo wouldn't be that big of a deal, but eating a whole entire package of them, maybe it has a bigger implication on their health. So we need to think about what we're treating ourselves, how we're holding ourselves accountable, being very honest and true. Yes, I did not carry through on that behavior change, but not having unnecessary negative attitudes towards ourselves. All right. Something else that comes up quite a bit in the literature is the idea of coaction. And this gets back a little bit to the idea of self-efficacy or building that confidence. And essentially it means that when you change one behavior and you're successful at it, it increases the chance of changing other behaviors. There's limited research, and this is basically highly dependent on the individual, whether changing multiple behaviors at a time is recommended or trying to do one thing first. So an example of this that sort of comes up for me in my clinic area is, if I'm trying to get someone to both add exercise and change their diet, for some people doing those two things at the same time will make them more successful. And for some people that is too overwhelming and it's too much. And so they'll end up being unsuccessful at both of those things. And so sort of a question you can ask yourself, or a question you can ask the people that you're working with is, let's think through this. How do you know yourself? Okay, when you're doing multiple things, are you likely to get overwhelmed? Do you like to break things down into smaller pieces? Do you like to sort of just clean slate and do it all as a big whole? What do we think? What are some examples of things that you've done in the past? And have you been successful? And so could we emulate that with what we're trying to change here? All right. Again, because of that idea of self-efficacy, you can also use this to build confidence in someone that's trying to change their behavior. So if you can have someone think back on something that they maybe really identified with it as part of their self-image. I never thought I could do this, but they've made that behavior change and they're doing it consistently. That can be used to help build confidence that they can make the next behavior change. All right, so just trying to think more broadly, what ways could you use this information in your individual fields of study? And so what I'd like to do is just take a couple of minutes, and I want you to think about either for you as an individual, or if there's someone, thinking of yourself in your future career path. Again, whether you're managing people, whether you're working with patients, you're teaching individuals, you're coaching individuals, whatever it might be, think to yourself and sort of think, where would be a situation that I might have to influence or change either my own behavior or someone else's behavior. All right. Think about through each of those steps, pre-contemplation, contemplation, how could you potentially move through someone or yourself through those different lines? What would need to change? What could be different? So taking some time to practice and do these things on your own will be more likely to make you more successful in moving forward. And with that, I would like to open it up to any thoughts or questions that you all have for me. Feel free to send in the chat or to unmute. All right, thank you, Lauren. She says, I work with kids, so it would be a simplified process. And yeah, I think it's important to note though that it would be simplified, but the same basic steps would be there, right? So sometimes when you're working with kids and they don't want to make a change, sometimes you have to find out, again, going back to that pre-contemplative stage, there might be some sort of fear or some sort of lack of knowledge. They don't really know what's going on, so they're not ready to make that next step. Right. I see this all the time in my 3-year-old, right? So I sort of had to work through with her what wouldn't be scary about doing something. So that way she might be willing to try it. sort of going through there. So trying to get over those little baby steps. Yes, exactly. So if they have fear of the water, trying to take smaller steps to say, okay, let's demonstrate to you how you might be safe here. How do we break this down into little individual steps? How do we teach you the skills so that way you feel more comfortable? You know, trying to do those little things. And a lot of this could be basically working on those behaviors, right, to help manage their environment in a way that makes them feel safe. So sometimes maybe even having their parent or something around is also what helps contribute to that. So yeah, it can be applied to a lot of different people at a lot of different times. Yes, I see everyone is different and timing is a different factor for everyone. Yes, so good point. Highly individualized process. So this is the overall sort of theory of behavior change, but this is where you as the expert or you as the professional or you as the manager can help to break this down and help people understand this. What I see time and time again is even, you know, people that have years of experience in different things, have tons of education, have lots of overall knowledge, sometimes are really terrible at doing these things themselves because they haven't taken that time to kind of sit back and work through these different steps. Even myself personally, right? Sometimes I criticize, my first step is to criticize myself. Why can't I just do this differently, right? But I haven't necessarily taken the time to sort of sit down and look at things. Oftentimes, and this is often a shock sometimes to patients, if they are specifically referred to me to do something, right? To change that they're a smoker or to work to improve their blood sugar. Oftentimes I'm the one slowing them down because I'm saying, you know what, we're not going to walk out of here today being automatically better at this, okay? We have to take the time to work and build these skills so that way we can be long-term successful, because if we can just change this behavior for a couple of days, that's not going to give us the benefit if we can change it from here moving forward. So very individualized. See another comment here. Would you say that resilience, which I think adversity and adjustment are necessary to be resilient, is a good word to use to manage the setbacks across the board in whichever work area you work in? Yeah, I think resilience is a great word that describes it. And I think again, the biggest thing that I would say is taking the time to really think through why something was a setback or a failure, and thinking what if there needs to be some additional steps besides just jumping back in. I think resilience is really great, but I think a lot of times it can affect people somewhat negatively because maybe something is actually could really help remove that barrier for them or make it be less. But by just telling people, well, be resilient, you just have to keep kind of attacking the problem the same way over and over again, we're sort of setting them up for failure, right? So sometimes in those moments of resilience, it's, yes, we need you to be resilient, but let's be smart about this resilience. Let's take a step back. Let's think about what should we change or what could we change to maybe make this slightly easier or slightly different for you. So that way you're more prepared to be better at it going back in. So resilience, I would consider, is the attitude of being willing to try again, but we need to still make sure we give that support when making those changes versus just, you know, keeping it. So it's, I guess it's the idea of like, again, if I tell someone, I keep going back to the example of being a smoker, right? But if I tell someone that they need to quit smoking right when they leave my clinic office, but as soon as they walk out to their car, they have a whole pack of cigarettes and their car smells like smoke and it already has an ashtray, I'm not setting them up for success. So I could keep telling them, be resilient, keep trying, right? But unless I help them remove some of those things out of their way, they're probably not going to be successful. But yes, definitely a good point. Great comments, guys. I appreciate them. All right, well, I don't see anything else coming in, but I really appreciate your attendance and insight today. And I guess I would just say, I think no matter where you guys all end up, I know you'll go on to do great things, but I think helping people change behaviors or changing your own behaviors is going to be a part of it. So hopefully there's a small piece of this that you guys can use moving forward, or reinforce something that you're already working on and trying to do. So with that, I believe I will turn it over because I think y'all have some next steps with some forms to fill out.
Thank you, Dr. Chaplin, for that presentation. And thank you guys for also being respectful throughout. Right now, I'm going to have to put the link into the chat. So make sure you fill out your form link to receive credit. And again, if you don't receive the form link and you have a technological difficulty, reach out to me and I'll give you an alternative assignment so that you can get credit for this particular Lyceum. And Dr. Chapman, I'm gonna email you right after this session as well, okay? Thank you so much.
Sure thing. Thank you, guys. And again, my contact information, you can find me on the Wingate website or whatnot. So anybody has any questions or anything I can help you with moving forward, please let me know.